Hello and welcome to the Paediatric Specialist area. This is a presentation on hydrocephalus. So we're going to start with a few questions to find out what you already know. So question 1. Hydrocephalus is an accumulation of which of these? Is it CSF in the brain, blood in the brain, or water in the brain? So remember that it's a problem that occurs in the ventricular system of the brain. So therefore it's a CSF problem. So question 2. Hydrocephalus is split into two types. What are they? So is it acute and chronic, communicating and non-communicating, symptomatic and asymptomatic, or intraventricular and subdural? So these two types can also be referred to as obstructive and non-obstructive. So that's communicating and non-communicating hydrocephalus. So question 3. Which of these is not a sign of raised intracranial pressure? Is it a headache, vomiting, hypertension, or hypertension? So remember that the pressure is increased in the brain. So therefore hypertension is not a sign of raised ICP. So we're going to go through what is hydrocephalus, some of the symptoms and history, investigations and differentials, clinical examination, and a few questions at the end. So what is hydrocephalus? So it's an accumulation of CSF in the brain which causes increased pressure inside the skull. So there's two types. So communicating or non-obstructive is impaired reabsorption of the CSF. So that can be caused by congenital malformations, posterior fossa neoplasm, or a vascular malformation, or an intraventricular hemorrhage. And the second type is non-communicating or obstructive, so obviously that's an obstruction, so it's a disruption of the flow of CSF. So causes a subarachnoid hemorrhage and meningitis. So some of the symptoms of hydrocephalus. So in infants, you would have a disproportionately large head circumference and the sutures would separate and causing the anterior fontanelle to bulge. You'd also get some of your typical symptoms of poor feeding, irritability, reduced activity and vomiting. If it was an older child, then they'd display the signs of raised ICP that we talked about earlier. So headache, nausea, vomiting, hypertension and confusion, double vision, things like that. And its severe stages, that could be loss of consciousness or coma. So a late stage sign, which is a classical sign of hydrocephalus, is a fixed downward gaze, which is referred to as the setting sun sign. So in the history, you can ask about symptoms which are specific to the age, because as we discussed, the infants and older children present quite differently. So in babies, remember to ask about your generalised symptoms. Ask if the child's head looks abnormal for them, because obviously the parent knows what is their normal. Ask if they've had any seizures, as sometimes it can present with those. Ask about the onset of symptoms because it's quite a rapid onset disease. So investigations, so you do a CT head to assess the size of the ventricles, you do an MRI to evaluate for tumours or Chiari malformation, you do an ultrasound through the anterior fontanelle to find evidence of hemorrhage, and you do an EEG, which is used generally if the child has a seizure. So your differentials, so it could be an acute subdural hematoma, it could be a brainstem glioma, it could be just a migraine, it could be an epidural hematoma, it could be a frontal lobe epilepsy if it presents with a seizure, it could be an intracranial hemorrhage, a meningioma, or paediatric idiopathic intracranial hypertension, or a pituitary tumour. So when you examine the child, so in the infants, you'd obviously measure the head circumference, and it's classed as being abnormally large if it's above the 98th centile or if there's a rapid increase across the centiles. So palpate the sutures for any disjunction, look for any dilated scalp veins, and look for the setting sun sign that we discussed earlier. So the gaze is downwards and the upper lids are retracted, and assess for increased tone. So if you're looking at an older child, use your ophthalmoscope to look for papilledema because that can be a sign of raised ICP. Look for the failure of the upward gaze, so the setting sun sign again, and percuss the head, and if it sounds like a cracked pot on percussion, that can be a sign of hydrocephalus. Assess for unsteady gait and spasticity, and look for a large head. and also do a cranial nerve exam because raised ICP can cause a sixth nerve palsy. So some tips for your OSCE. So remember that the age of the child is really important, and the symptoms and signs are very different dependent on age. So, as we said, babies will have the increased head circumference, open sutures and generalised illness, and older children it will be more signs of raised ICP. So establish the normal for the child, so obviously talk to the parent about if that head size is particularly abnormal for them, and find out if it's rapid onset. So older children, remember your cranial nerve exam and your ophthalmoscope, and then just remember your general paediatric history and examination skills. So asking the parent but keeping the child involved, making it like a game to keep the child concentrating, and remember you can gain a lot from inspecting the child. So a few questions to finish. So which of these is not a cause of communicating hydrocephalus? So is that a subarachnoid hemorrhage? Is it a posterior fossa neoplasm? Is it an intraventricular hemorrhage? Or is it a congenital malformation? So remember that communicating hydrocephalus is impaired CSF reabsorption. So it's a subarachnoid hemorrhage because the CSF is in the ventricles. Question 2. Which congenital malformation isn't a cause of hydrocephalus in babies? Is that the Chiari malformation, aqueduct stenosis, anencephaly, or atresia of outflow of the fourth ventricle? So remember that hydrocephalus is an abnormality of the ventricles in the brain. So the answer is anencephaly because that's just a lack of the brain altogether as opposed to a problem with the ventricles. Question 3. What is the setting sun sign? So is it an upward gaze, a downward gaze? Is it the head and neck falling forwards, or is it the head and neck dropping backwards? So it's a late stage sign of hydrocephalus that we've already discussed. So the answer is it's a downward gaze, so it's to do with the eyes. Thank you for watching.